Ever been in the locker room and wonder why some guys look like they're packing heat even when chilled out, while others, well, surprise everybody in the bedroom? No, we're not talking about your garden or your bathroom habits. It's the science. And we will talk about how some penises transform like superheroes and others are just there. But first, let's set the stage with some eye opening global stats on size. Stick around because by the end, you will know if your team is team grower or team shower, TG or TS. You're going to DM me at the end. Plus some real talks, ways on how to potentially level up your size. If that's your vibe, subscribe to my channel. I'm Dr. Barr. Thank you for tuning in, and let's dive into this interesting topic. First, we're going to talk about the size. We're going to clear some wrong information out there. So, according to a study in 2023, a systemic review of 55,000 men worldwide, the average flaccid penis length, are you ready? 3.4 inches. Stretching it, 5.1 inches. When fully erect, 5.5 inches. For girth, and that is the circumference, is the average flaccid is 3.7 inches and bumps to 4.6 inches when erect. And that's what matters during intercourse. The average flaccid running at 5.5 is the general ballpark. Most of the 95% of the men are within the normal range. So you're average, you're in good company. Now, for some worldwide trivia, I thought I'll share that. The average size varies by country. Topping the chart in Africa is Sudan. It's at 7.1 inches, fully erect. Congo, another country in Africa, 7.1 inches. Republic of Congo. Ghana, 6.8 inches. Crazy, right? But remember, these are averages from compiled studies, and the site doesn't dictate the prowess. It's all about how you use it. So, what do growers and showers even mean? A grower is when your penis expands big time from soft to hard. Think an increase about 1.6 inches or more. And that is about 56% in relative growth. Boom, instant upgrade. On the flip side, the showers mean minimum change, usually less than 1.6 inch, about 30% increase. It's already showing off close to its full potential when flaccid. So both of them are normal and neither affects how well it works. But why the difference? Let's go over the science that has to answer this. The difference between a grower and a shower. They both have the same layer called tunica albuginea. The grower has it elastic and soft, so it can stretch. The shower, it's thick like a tight cage. It does not stretch much. So during an erection, cavernous tubes that fill with blood supply stretch the tunica albuginea, and the shower will stretch more, right? So it is all anatomical. What is in these tissues? The tunica albuginea is made of elastin protein and collagen. So those that are showers are rich in collagen and elastin. That is the only difference. It's genetics. It's determined since age 1 of birth, and it does not affect your function. See, it's just simple. One is stretchy like a balloon, and the other is tight like a cage. This also changes with age. So, men as they age, the tunica albuginea, that sheet becomes more elastic. So, they become more showers than growers. That's another topic to discuss. Why does this happen? Because of inflammation, loss of collagen. Aging can also cause changes in the circulation. So these are the things that you can do to improve your penile health. Let's discuss this. So let us talk about some health issues that you need to take care of to have a healthy penis. Number one, some people are overweight. That fat of pad above the pubic fins, above your bone, retracts the penis inside. It's making it look like a vanishing penis. So weight loss, eating healthy, reducing your belly fat is important. Also, don't forget to eat a lot of collagen, healthy food in your proteins. Keep your circulation good. The American Academy of, I believe it's urology, of one of those, have condemned these things that are online, creams and pills. These are all not backed by science. They are not healthy and sometimes can cause harm. So all these interesting pills or creams are not scientifically proven and zero benefit and could be harmful. However, there are some clinical treatments that could be done to increase the size. One of them, there is a traction device that's been on the market, and they claim with consistent using constantly every day, there might be reported zero point 0.5 to zero point 0.8 inches increase in length. But that is something that you need to use all the time. That is a newer device. The second thing is the P-long. They call it the P-long, and that's a PRP, meaning like they draw some plasma out of your blood and they spin it and they inject it in the penis. That can help, especially with people with some erectile issues or scarring, that can shorten the penis. Some people also might have something called Peyronie's disease, which is a scar tissue that accumulates in the penis due to trauma. We've seen it with some people who did the trimix injections in the penis for ED, and that can end up shortening the penis. And P-lung is the injection or the procedure that we can do. Some clinical studies showed increase in also zero point 0.8 inches in the penis. But also there's a bonus, it sometimes increases the girth. P-lung also was combined with other products like Botox that helps actually relaxes the muscles, improve the circulation, and it helps reportedly in some patients with mild ET. So this is the P-lung procedure. The third one is surgical, and that is for people who need elongation of the ligament, and that is a total surgical procedure. They need to see a neurosurgeon for that. So, bottom line, stay healthy, eat healthy, lose the pad of fat, so to avoid the vanishing penis. And now we know growers are sure it doesn't matter. It's how you use it. Please comment, are you team grow or team S show? And if you have any questions, I hope this was a good topic for us discussing what is out there that could be wrong about size and myths and why a shower or grower doesn't matter. Enjoy.